Good morning, everybody. I am Dr. Kanhu Charan Patro, neuro radiation oncologist. Today, I am going to talk about the gray and white matter of the brain and how it looks in the MRI and in CT. There are two kinds of tissue. One is the gray matter, another is the white matter in the brain. Gray matter contains most of the brain's nuclei, neuronal cell bodies, that is outside. White matter is made up of axons connecting different parts of gray matter to each other in inside. So this is gray matter, outside gray matter, inside white matter. You can see inside white matter, outside gray matter. The nuclei are situated in the gray matter, and white matter the neuronal tracts, neuronal connections. So if you see the gray matter, it is constitute the 40% of the brain, and white matter constitutes the 60% of the brain. Contains mostly neuronal cell bodies made up of bundles connect to the various gray matter areas. Serves process of information, allows communication to and from gray matter areas and between the gray matter and the other parts of the body. Fully develops once person is 20 years, but it develops throughout the 20 year and at the middle age. So if you see the brain and spinal cord differences, in brain the gray matter is outside, white matter is inside, but in spinal cord it is opposite. Gray matter inside, white matter outside. You can see here. So brain, as I told, gray matter outside, white matter inside. Cord, white matter outside, gray matter inside. See, in spinal cord, white matter outside, gray matter inside. So if you see in the CT scan, actually white does not look white. So if you see, this is the white matter in the center, but it looks dark. You can see here dark part. So in CT it is the dark, the white matter is dark, and the gray matter is the slightly brighter. In MRI T1 image, white matter looks white, gray matter looks gray. Remember exactly what white matter looks white, it is in the T1. So anatomy, to understand the anatomy, always use the T1. T2, just flip side of T1, you can see the gray matter looks brighter and white matter looks darker. So normal MRI brain sequence: CSF dark in T1 weight, T2 weighted bright, flare dark, white matter light, T1 weighted, T2 weighted dark and flare dark. Cortex, that is a gray, looks like gray, gray matter looks gray, and this is the lighter, these are the lighters. So white matter and cortex, gray matter and white matter, exactly you can appreciate better in the T1, and just flip side in the T2 and flare. So this is called gray white junction. You can see in the brain meds what is the predilection to gray white junction. These are called gray white junction, and brain meds are mostly we can encounter in the gray white junction. If there is a stroke, there is a cytotoxic edema, so there is a loss of gray white matter junction. So if there is a gray white junction, cellular swelling, gray white margin lost, then it is think that is a stroke. If there is a maintained, it is a vasogenic edema, it is called in the brain tumors. So gray white junction or margin lost in stroke and maintained in the tumor. Thank you very much. This is all about the gray matter and white matter. Thank you very much.